Can focal adenomyosis impact my chances of getting pregnant? Imagine trying to conceive and facing unexpected hurdles. Focal adenomyosis might be one of those challenges. This condition involves endometrial tissue growing into the muscular wall of the uterus, which can cause changes in its structure and function. These changes can make it harder for an embryo to implant successfully. The uterine environment becomes less friendly because adenomyosis can disrupt the junctional zone, leading to abnormal uterine contractions and increased pressure inside the uterus. These factors can interfere with the embryo attaching to the uterine lining, reducing the chances of pregnancy. Research shows that women with adenomyosis often experience lower pregnancy rates, especially when undergoing assisted reproductive procedures like in vitro fertilization. Even when other factors like age are considered, the presence of adenomyosis can decrease the likelihood of a successful pregnancy. This is partly because adenomyosis increases the risk of early pregnancy loss or miscarriage, especially in the first trimester. The altered architecture of the uterus and inflammation associated with adenomyosis can make it difficult for the pregnancy to be maintained. There is also some evidence suggesting that adenomyosis might increase the risk of ectopic pregnancies, where the embryo implants outside the uterus. This happens because the abnormal uterine environment and impaired transport of the embryo through the fallopian tubes can lead to such complications. However, it is important to note that adenomyosis does not seem to affect the quality of the eggs themselves. The issue mainly lies within the uterine environment, which is crucial for implantation and early pregnancy development. Many women with adenomyosis also have other conditions like endometriosis, fibroids, or polyps, which can further impact fertility. Because of this, it can be difficult to determine how much adenomyosis alone affects fertility versus other coexisting issues. For women trying to conceive with focal adenomyosis, treatments such as hormonal therapy with gonadotropin-releasing hormone agonists can help reduce symptoms and improve the uterine environment. Surgical options to remove adenomyotic tissue may also be considered, especially if previous fertility treatments have failed. Assisted reproductive techniques like in vitro fertilization can be optimized with specific protocols to improve outcomes. Emerging treatments like high-intensity, focused ultrasound are being studied as less invasive options to manage adenomyosis while preserving fertility. Overall, while focal adenomyosis can pose challenges to conception by impairing embryo implantation and increasing miscarriage risk, it does not affect the quality of the eggs. Consulting with a fertility specialist experienced in managing adenomyosis is essential to develop a personalized plan. Remember, each case is unique, and with the right approach, many women can still achieve their pregnancy goals. Always seek medical advice tailored to your individual situation to explore the best options for you.